Okay, well, again, welcome. As we get started, I would like to introduce to you two of the members of our team. Sarah and Sarah Willink is my daughter, and she came on board about 4 or 5 years ago, fully licensed, and does a great job. Very knowledgeable, and just does a wonderful job. And Kelly Dominy, Kelly and I have been working together, kind of side by side, for about 17 years. She had an agency in Grand Rapids, and we got introduced to each other way back then, and just kind of shared ideas over the years and worked pretty closely together. And then uh, to our great benefit, she joined us about 4 years ago, full time now, that we work together, and she's all part of our team now. So brings a ton of knowledge, a ton of experience, has worked for some of the big insurance companies over the years prior to us getting together. So she's full of knowledge as well. So, and then we have two others that are Lori Veneman. Some of you may have talked with her, also a great agent on board for about 5 years now. And we also have a pharmacist who's a great resource for us when it comes to um, anything related to prescriptions. So his name is Steve, and we rely on him a lot. So what we're going to do again is we're going to get started. If you have questions, go ahead and type them in the box. If we need to address it then I'll jump in. Otherwise, we're going to let the ladies kind of take over for a minute. And all right. It looks like chat may be disabled, so let's stick with just the Q&A box as far as questions you may have. So I'm going to share a screen here, and Sarah is going to get us started on our presentation. All right, Sarah.
All right. So at our in-person workshops, I started off by asking everybody to raise their hand if they were excited to talk about Medicare. And so doing it online like this or virtually, I don't get to see all your hands raised. So I will trust that you all are just as excited as I am, and Bill is, and Kelly is, to talk to you about Medicare. So as he said, Bill is my dad. I mention that because while I do my best to refer to him as Bill as much as possible in professional settings like this, he has been my dad for far longer than he's been my colleague. And so I can almost guarantee you that dad will slip out as we're talking today. So I just hope you understand. All right, so I'm just going to get started with a few basics. And wondering if we can get it to the screen. Let's see here. Yep, one more. There we go. Okay, a few basics overview on some of the things that you guys can expect next year in 2025. So every plan will have a $0 PCP copay. So the copay for specialists will vary depending on your plan, but when you see your primary care provider, you can expect that there will be a $0 copay on all the plans. In terms of, let's see, I just lost there we are. PT, OT, and ST, which stands for physical therapy, occupational therapy, and speech therapy, those copays have been lowered on multiple plans. And then the Value and the Thrive Plus will now have, or in 2025, will have the highest comprehensive dental benefits embedded or included in the plan. So every Advantage plan through Priority Health has a name, and many of you are on the Key or the Edge. Priority Health does have 8 other Advantage plans, and they all have names. I will draw your attention to, there is one called D-SNP. We'll call it D-SNP. And that plan is for folks who are dual eligible for both Medicare and Medicaid. So that plan does not apply to the vast majority of our clients. So if you see that in the literature that you receive from Priority Health, or you hear people talk about the D-SNP or the D-SNP plan, Advantage plan, just you can kind of put that out of your mind and just kind of ignore that. That does not pertain to most of you. So in addition to the Key and the Edge, then there will be 7 other plans that will be available next year. So So this year, just going off of that, the dental thing, one more comment on that. This year, the Key has a pretty substantial dental benefit. So next year, as you see on the screen there, the plan called the Value and the plan called the Thrive Plus will be the plans that have the highest comprehensive dental benefits. I want to draw your attention to the email that Bill sent out, included some attachments. One of those attachments is the agenda. And then further down on the agenda, there are some categories. And so just to kind of have that, if you have that in front of you, it might be helpful to reference as we go through the presentation, just to kind of the different categories of things that may be important to you when considering an Advantage plan for next year. So a little bit about the vendor updates with the names. So we wanted to just put these names out here so that you guys could, if you hear them, you're aware of what they are pertaining to. So Silver Sneakers has been the fitness benefit, or the name of the fitness benefit, for quite a long time. Next year in 2025, that will be now called, or that will be called One Pass. So no longer Silver Sneakers, but it will be called One Pass. They are adding the YMCA to that benefit. And then, of course, they're keeping Planet Fitness, MVP, Holland Aquatic Center, Evergreen Commons, some of those other facilities that you probably know and hopefully are utilizing. They're also adding some specialty gyms, one of which I know is Orange Theory. I'm not entirely certain all the other ones, but I believe there's a couple of other ones too. And then, of course, they'll have digital and online classes that you can utilize from the comfort of your own home if you would choose to do that. Brain HQ will be called Cognifit next year. And then I believe that the over-the-counter card that most of you receive, it just says OTC on it, but the company has been a place called Convey. Next year, it will be changing to a company called Lynx, Lynx. They are adding Costco this year, so hopefully that is exciting to some of you. The OTC catalog that you'll receive will, for 2025, will feature about 200 of the most commonly purchased items with pictures. So that's fun. But you can access the full list online that includes far more than 200 things. So just when you see that catalog, you can just rest assured that it's the most commonly purchased items, but there are other ones that are included. So, and then another piece of good news, ordering from the over-the-counter catalog next year, they're telling us the cost will be, or the prices will be about 30% less than they are this year. So many of you have pointed out to us that it seems like the prices are a little high when you order through the catalog. Hopefully next year, with the reduction of that, with the 30% reducing of the cost, that will help a little bit too. So next year, okay, let me back up. Some plans include a benefit called Pop-A-Pals. So that is not available to those of you who are on the Key, but there are other plans that do include the benefit called Pop-A-Pals. That is going away in 2025. Instead, they're adding a company called Carallel for caregiver support. So if you are caregiving for someone, or if someone is caregiving for you, then they would have access to this company called Carallel. And from what we understand, that will be more of a virtual service. So you can, or the person that you're caring for, or the person you're caring for, or that's caring for you, I should say, can call or text or chat with a person online through Carallel. And the goal is that they would be able to provide some support or some resources to you, or to the person who is taking care of you. So if you are a person, we've heard a couple different people in our in-person workshops were quite disappointed that benefit is going away, or the Pop-A-Pal benefit is going away. If you are a person who depends on the Pop-A-Pal caregiver, and that is a great loss to you, then let us know. I may be able to help you with some other resources that are unrelated to insurance, unrelated to Priority Health, that maybe some community resources that could fill in that gap a little bit for you. So if that is you, then let me know, and we'll see if we can get you taken care of. Mom's Meals has been a benefit that was available post-hospital inpatient stay. That is still available next year in 2025. However, it will be private pay and it won't automatically be generated after you return home after a hospital stay. So just keep that in mind. And then iMed for vision, True Hearing for hearing, and Delta Dental for dentist needs will remain the same networks. So we'll touch on that a little bit later as well. Okay, for those of you who are on the key, we emailed you the attachment for the 2025, the sheet for the 2025 things that are included in the key for next year. If you want to reference that while we're talking about it, otherwise I'm just going to go over some of the things that you see on the screen here. We have a side-by-side, 2024 is on the left, and then 2025 is on the right. I want to, first of all, just clarify the regions. So if you, there's going to be a couple different points in the rest of the presentation where we talk about region. And so if you live in Kent County, Ottawa County, Allegan County, or Barry County, then you are in Region 1. So as we go throughout the rest of the presentation, you can just make a mental note that you are in Region 1 if you are in Allegan, Kent, Ottawa, or Barry counties. If you're in one of those surrounding lighter green, as you see on the screen, those are Region 2. And so if you are not in one of the 4 counties I mentioned, then you're probably in Region 2. And then obviously the applicable, the numbers that we talk about for the regions, Region 2 would apply to you then instead of Region 1. So historically, the key and the edge have been kind of our front runners. And so when we talk about the changes for next year, we kind of compare the key and the edge. This is really important, what I'm going to mention to you now. Priority Health, this is going to be changing a little bit going forward. So Priority Health has put a lot of work into ensuring that all the plans, all of their Advantage plans have the same value, but where that value shows up will be different according to the plan that you're looking at. So going forward, it's not going to be so much a question of, you know, what's the best plan? What are people kind of choosing? You know, what has the most, you know, the greatest benefits or whatnot. The question is now going to be, what is the best plan, or what plan makes the most sense for me according to my needs, according to what I wish to have in a plan. And there's the categories that are on that agenda form that we attached to the email kind of go over some of those categories that you just want to be considering as we talk further here. So let's see here. I'm just going to go over some of the considerable changes from 2024 to 2025. So the main thing that you'll notice with the key is that well, I'll say first of all, the premium remains $0. So you pay $0 per month right now to be on the plan. Next year, that will remain $0 to be on the plan. The biggest change really is the addition of a deductible. So in currently 2024, you have $0 deductible. That means you just go right into copays. In 2025, there will be a $275 deductible. Now, potentially, I should say potentially. So don't be afraid of that. It does not apply to everything. Kelly is going to talk more about that in a section after I finish here. So that's just, I want to point that out to you. Inpatient hospital stay is going from $320 per day. Next year, it will be $350 per day. And it's important to just remember that everything that happens as an inpatient in the hospital is included in that copay. The average hospital stay is about 2.5 days. So if you were to stay past the average hospital stay, past 7 days, then everything would be covered. So, but meanwhile, yeah, $350 will be what you can expect to pay as a copay for an inpatient hospital stay next year on the key plan. Good news for people who see specialists routinely, that copay is going down from $45 this year to $40 next year. Diagnostic, radiology, and imaging, so that's your CT scans, your MRIs, that is going up from a $160 copay this year to a $225 copay next year. And then the copay for outpatient procedures is going from $290 this year to $350 next year. Now, remember, that's an up to copay. So depending on the procedure, you may pay less than that, but $350 is going to be the maximum that you would pay next year. ER and observation copays remain the same. And then just another reminder that the ER or the emergency room copay covers everything that happens in the emergency room. So if they determine that based on the results of the testing that occurs in the emergency room that you need to be admitted, then that emergency room fee will be waived and you will go right into the inpatient hospital stay copay. The over-the-counter benefits currently this year are $100 per quarter. Next year, they will be going down to $75 per quarter. And then, as I mentioned earlier, the embedded dental benefit will not be as substantial on the key as it will be on other plans. There's $2,500 embedded for the key, and next year that will be going down to $1,500, which is, I believe, what it was the year prior. Okay, I'm gonna move on to the Edge and talk about some of the differences there. So again, same as the key, the premium remains $0 for next year. So you pay $0 per month to be on the plan. That will be the same next year. They are adding a deductible as well. On this plan, the Edge, the deductible will be $195. And again, that does not apply to everything. So Kelly will go into more detail on that. You also received an attachment in the email with information related to the deductible, so you can reference that too. Inpatient hospital stays on the Edge, $320 per day, up to days 1 through 7. And then next year, that's going to be $350. Specialist copay is decreasing from $45 this year to $35 next year. Outpatient procedures, $325 this year and up to $350, I'm sorry, rather next year. And again, keep in mind that's dependent on the procedure that you have to. You may pay less than that. Emergency room and observation copays also remain the same next year as to what they are this year. And then I also spoke earlier about Papa's Pals is now going to be a company called Carallel. I want to point out a substantial thing here regarding the over-the-counter benefits. They are changing from quarterly to monthly. So right now it's $95 per quarter, and next year it will be $25 per month. So keep in mind a couple of things with that. Over the counter will remain a use it or lose it situation. So if you don't use your benefit in that month or that quarter, depending on the plan that you're on, some are quarterly, some are monthly, then you do lose it. So we had somebody bring up in one of our workshops, say I stay on the Edge, or say I go to the Edge and I have the $25 per month over the counter benefit. What if I want to purchase something that costs $70? And unfortunately, if you're on a plan where the over-the-counter benefit is monthly, then the monthly benefit is the maximum that you would have to spend. So you would have to find something that's under $25, or you'd have to put your own money towards a more expensive item that you may want to purchase. So that's something just to keep in mind, that, I mean, time flies and it can be easy to lose track of that. So if you are on a plan such as the Edge that has a monthly over-the-counter benefit, then just to make sure that you don't lose that. So Okay, Kelly is going to talk now about the deductible and some of the plans regarding that.
Okay, thank you, Sarah. Yeah, so we have gone over the key and the edge in detail, and now I want to kind of step back and take a bigger view, a bigger overview of Priority Health plans and how they've arranged them for next year. So Sarah mentioned, I believe that there are 10 plans. There's actually only 9. There's one she mentioned, the DSNP, the DSNP, that doesn't really apply to you if you're on this webinar. So we have 9 plans. And if you're looking at this triangle right here, and you'll notice that one edge says 0 premium with deductible. There's another edge that says premium with 0 deductible. And then there's one plan only that has 0 premium, 0 deductible. So you're either going to pay, in most cases, you're going to pay either a premium or you're going to pay a deductible next year, unless you're on that bottom of the triangle, the one plan that says 0 premium with 0 deductible. On the right-hand side of your screen, you'll see they have the 3 categories of plans, and there's a name for each of them. And there's 4 plans that are 0 premium with a deductible, and 4 plans that have a premium with no deductible. And then again, the one plan called the Vintage, and we'll go over all of these plans. Well, we're not going to go over all of these plans. We're going to go over one example from each of these 3 categories. In addition to the 2 that we just saw, Key and the Edge are both at the top. In the top category, they're both the 0 premium plan with a deductible. Okay, and Sarah just went over those. But again, I want to really emphasize again what Sarah said initially, that all these plans are equally invested with Priority Health. They're all funded. They all have equal value in what in coverage. What they've done, each plan just is emphasized a different area of benefit. So that's why that sheet that you have that was emailed to you, it lists some things to kind of for you to look at, to think, what's important to me? Do I really need a fitness benefit? Do I want a really good over-the-counter benefit? And then you're going to kind of use that to see if the plan that you have still works or if you want to change. So again, this is all plans are really created equal. They're just a different benefit is emphasized in each of them. So we're going to go ahead on to the next screen here. And we're going to talk about the deductible. As I mentioned, there's some of the plans have 0 premium, but they do have a deductible, and the Key and the Edge have deductibles. But not everything that happens is the deductible will not apply to everything that happens to you medically. So on the left-hand side, these items on the left do not, you will not need to pay a deductible first. So for example, the first line, your primary care visits and your specialty provider visits. You go see these doctors, it can be January 1st of the next year, January 2nd of 2025, and you're going to just you're going to just pay your copay. Or primary care visit is $0 copay, so you would have no charge for that. You don't have to meet a deductible first. And I just want to make sure we understand what a deductible is. A premium is what you pay every month to have the plan. Maybe you pay $20 a month to be on the plan. A deductible is what you pay first before your copays will kick in. Like a car insurance has a deductible, or house insurance has a deductible. You have to cover that first before the insurance will help cover anything. So same thing with medical. So continuing down that side, that left-hand column there, outpatient mental health and psychiatric services, partial hospitalization, home health services, acupuncture and chiropractor. Okay. Those things, PT, OT, ST, that's again, physical therapy, occupational therapy, and speech therapy, podiatry, outpatient labs and outpatient tests. So if your doctor says, hey, I need you to go get a blood draw, or maybe a test at a lab, those, of course, your deductible is not going to apply there. ER, urgent care and observation, durable medical equipment, prosthetics, medical supplies, diabetic supplies, and diabetic therapeutic shoes and inserts, kidney disease prevention, preventative services, and Part B insulin. So that's a pretty good list of things that you do not have to worry about your deductible if you have a plan with a deductible. On the other side of the page is things that the deductible will apply to. So for example, if you go inpatient, of course, you're going to have to pay your deductible. And then after that, you would pay your per day amount. So again, I want to remind you that the Key and the Edge that we just went over, which probably what most of you on this webinar right now have one of those two plans, they're zero premium plans with a deductible. So just like last year, you won't pay a premium in 2025 if you stick with this plan. You will have a deductible, but it will only apply to the things on the right-hand side. It will not apply to anything on the left-hand side. So it may not feel that much different, just depending on who you are. Okay, let's move on now. And I'm going to show an example from one of each of those categories. This is another example of a zero premium plan that has a deductible. Okay, and this is the Vital. The Vital has a deductible of $375. This plan has a Part B buyback, $45 a month. That means you will get an extra $45 in your Social Security check. If you remember to pay your Part B premium, the government takes it out of your Social Security check and then they send you your check. So you would get an extra $45 in that check. If you're not collecting Social Security and you're just paying your Part B premium monthly, it would be $45 less. So you're going to gain $45 a month with this plan. You'll get it back. This has an OTC and over the counter of $25 per month. So again, this is a monthly amount. Remember, that's the use it or lose it amount. $0 for True Hearing Advanced Hearing Aids. So this particular plan is really strong in the benefit around your hearing aids. So you get one per ear every 2 years. That's $0. Okay. And then this one has also the tier 3 prescriptions, Medicare prescription drug plans every prescription is in a tier. They're 1 through 5. That's how they're all engineered. Generics are usually in tier 1 and 2, and then you get more expensive as you go a higher tier. Tier 3 is typically a brand name drug. This particular plan, tier 3, has $42 for a tier 3 prescription. This is for a 1 month supply. Other plans are going to be a percentage. We'll see that moving forward. But so this plan, the Vital, again, $375 deductible, and it has a good hearing aid benefit and a part tier 3 good copay. Okay, now you can move on to the next one. Thanks, Bill. So this is a value plan. Now this is a plan that has a premium with no deductible. And this particular plan, if you're in Region 1, which is Kent, Barrie, Ottawa, and Allegan, I think Sarah covered that too. So this, if you're in Region 1, which is one of those 4 counties, you're going to pay $18 a month to have this plan, but you will not have a deductible at all. The inpatient in this plan is $325, and outpatient is $325. This has an OTC over-the-counter benefit of $50 a quarter for Region 1, $25 if you're in other regions. Now this plan, the emphasis is the dental benefit. So this plan has the highest embedded. Embedded means included, in case you're wondering what that means. Included benefit. So it has the most included dental benefit of all of the plans this year, next year, 2025. It has your routine 2 cleanings, 2 checkups every year, plus an additional $2,000 for other services. Okay, and the next plan, the third one we want to look at, which is a vintage plan. This is the one plan that has 0 premium, 0 deductible. And why is this one 0 and 0 on both sides, premium and deductible? Because this is built around just your basic core medical coverage. It has no extras. It has no dental, extra dental, just your 2 cleanings a year, the preventative only. It has no over-the-counter benefit, that $25 a quarter, none of that. And it has no fitness membership. It does not include the 1 Pass fitness benefit. It does have $35 specialists, and it does have as I mentioned, zero premium, zero deductible, and a max out of pocket of $5,300, which is a pretty average max out of pocket. So this is really just based around your core medical benefit. It does have also transportation in this plan. So it's really focused around you being your medical benefits and getting there. So transportation, 31-way trips per year to health-related locations, up to 100 miles. Up to 100 miles, yeah. And it's provided by a vendor company called Safe Ride. And then just one last thing here, this last page, talking about the dental and vision benefit. So depending, some of the plans we have, all of the plans have the embedded cleanings and the routine, and some of them have a little bit more. And remember, the value had the most included dental. But depending on which plan you choose, if you want to enhance, you can always add that rider. We call it the enhanced dental and vision. So you can add more dental and vision benefit. The premium to add that will be anywhere from $37 to $49 per month. And this is per person, depending on which plan you have already. What you're adding is $2,500 of additional annual coverage limit towards the enhanced comprehensive dental benefits, which are paid at 50%. So you would pay 50 and the insurance company pays 50, up to an extra $2,500 in coverage. You get an additional $150 in eyewear. And there's $100 included in most of the plans, so it would bring your total up to $250. And then just another reminder about the annual election period. If you're going to add this, just like your choices to switch a plan end on December 7th, this also needs to be added by December 7th, and it would take effect on January 1st. One important thing to remember about the enhanced dental and vision. So even if you're sticking with the plan you have, but you want to add dental, you have to do it by December 7th if you want it to be effective January 1st. And then you can drop it. Actually, you can drop the dental, this enhanced rider, anytime during the year. You can't do that with your whole regular base Advantage plan, but if you want to drop the rider by itself, that is a thing you can do during anytime during the year. Okay, there's that. And we're going to turn this back over to Sarah.
All right, I'm going to give, before we open it up for questions, I'm going to just give a few reminders. So we intentionally did a very high level overview today because we couldn't possibly go down every rabbit trail and give all the details of every plan that's out there. So what we wanted to make sure we give you a taste for what to expect for next year. If you are somebody who really enjoys kind of looking at all the ins and outs and comparing plans side by side, just to see that for yourself, you can visit priorityhealth.com/Medicare. If you go to that website, about halfway down, it says compare plans. And so you can click on that and you can add plans to, or click on plans to do comparison side by side. And it's a really helpful tool to be able to see, just to see the plan side by side and what each plan offers. I will caution you though, it's a Priority Health website, so it's not linked with the Willink Group. So if you go to the website, you will see things like, click here to chat with an agent, or click here to get some help determining what you need to do, or there's an option for the plans that says to add it to my cart. I would really caution you to be careful not to click on any of that, because that will disconnect you from the Willink Group. So that's what we're here for, is to help walk you through any questions that you have, or we'd love to do that. But if you would like to kind of sit down and just visually see things side by side, then that could be a helpful resource for you as well. If you do, so we talked about the changes. If you do nothing, even though there are going to be some changes to the Key and the Edge and other plans, if you do nothing, your current plan will roll over into 2025. So if you're feeling good about it, you don't think you want to make a change, then you will just have the same plan next year. The deadline to make a change is December 7, as Kelly mentioned. That is a Saturday. And because we anticipate having a pretty busy open enrollment or annual enrollment period, I should say, we're asking that if you know that you want to make a change, if you could please notify us by 5 o'clock on Tuesday, December 3rd. That just makes sure that we have the time to submit it to Priority Health and they can do what they need to do with it in order to get you squared away by the 7th. So just please kind of put that in your head. If you would like to make a change, that you would let us know as far in advance of that due date as possible is the most helpful for us. You can follow us on social media, Instagram and Facebook, the Willink Group. We try to post helpful content on there related to Medicare. So if that's something that you're interested in keeping up with, you can do that. And then we always say that our highest compliment is when you send us your family and friends. And we try to do a thorough job of explaining Medicare in a way that's simple and hopefully fairly easy to understand. And so then you're more confident going forward, knowing what choices make the most sense for you. So our highest compliment is when you send us your family and friends so that we can help them out too. So just with the referral program, if you send someone our way, we will give them a gift card and also give a gift card to you as well. And then the advisor is our newsletter that goes out approximately monthly. We also try to put not overload you with information, but try to put what we feel like is helpful for you to know in terms of Medicare related stuff again. And so if you're not receiving, if you have signed up for it and you don't think you're receiving it, maybe check your junk mailbox. If you are not receiving it and you've never signed up, then we would welcome you to sign up for that. And of course, you can go to our website, thewillinkgroup.com, for more information too. So all right, I think that's it. All right, Bill.
All right. Thank you, Sarah and Kelly. I appreciate that. And got a few questions here, first of all, that I just want to respond to. One was, are the Key and the Edge a type of an Advantage plan? We use our terms sometimes, just throw it out there, and you may not be real comfortable or knowledgeable about that. So the Key and the Edge and the Vital and all the plans that the ladies just went over are types of an Advantage plan. So all of you on this call or on this webinar have an Advantage plan. And different companies, Priority Health, Blue Cross, United Healthcare, Humana, they all have their own Advantage plans. And within that, they'll offer a variety, right? So Priority Health has 9 or 10, what do we say? 10 different Advantage plans for next year. The Key and the Edge and the Vital and the, what was the last one we went over? Doesn't matter. Those are all types of an Advantage plan. All right, that was one. Another one was deductible. Do you have to meet that deductible multiple times throughout the year? No. The deductible is a one-time event. So if you have some type of procedure or some health care that does require the deductible, whatever that costs, it goes toward that deductible. And then once you reach that, whatever that deductible is, that's done for the rest of the year. So it's just a one-time event. Sarah, Kelly, I got a question. I'm not sure the answer. Does the chiropractic care copay charge, or does it change in 2025 under the Key plan? I think it was $20 this year. Could one of you look that up and see if that changes for next year?
I believe it's the same, but I will look that up a minute. All
right. And then another question, does the automatic rollover include the enhanced plans? So yes, if you don't do the answer is yes. If you don't do anything with your plan, you just want to continue next year on the plan that you're on, and you have that enhanced dental vision rider, that will just continue on next year as well. If you want to drop that rider, which you can do any time of the year, it does require a form that needs to be filled out. So you would have to let us know on that. And
Bill, the chiropractor copay for the Key plan is $20 in 2020.
All right, so that stays the same for next year. All right, and then we'll obviously do some more questions here. I see a few more coming in. Great, and hang on just a second. All right, so just want to kind of cover a few more things in addition to what the ladies have talked about. So why did we call you guys in on this? Because a lot of the changes that have happened for next year are more than the ordinary amount of changes that we see. So I think what's happening here is Advantage plans, all the different insurance companies, they get a monthly stipend or they get a monthly amount for every person that's on the plan from the government, right? So for every one of you that has an Advantage plan, whether you use it or not, Priority Health or Blue Cross or whoever it is, they're getting a whole big chunk of money every month from the government. Well, over the last few years, the government's kind of been looking more and more at, hey, wait a minute, where can we cut back? Where can we, shave some money here? I know it's hard to believe the government is actually trying to save money, but anyway, I'll say that for another time. But the bottom line is, what we see happening is the insurance companies they're getting less from the government for some of these programs. So what they have to do is they have to trim somehow or adjust, and it comes in the benefits. Or it comes with things like now you have a deductible where you didn't before, or now the co-pays are a little bit higher. So they do their actuarial studies, they research all of this and figure how do we compensate for that. So that's, I think, why we're seeing a lot of the changes for next year. But as was mentioned, I don't think there's been a lot of loss of value in the plans. It just gets changed around. But the difference for next year is there are certain plans that will cater to certain things in your life that you might need. And again, the ladies touched on some of those. For example, if you needed hearing aids, none of the plans for Priority Health offer no cost hearing aids except for the one. It's called Vital. So if you're on the Key or the Edge and you think you might need hearing aids, on those plans, you have coverage for an exam, but you're going to have a copay for the hearing aids, which can get pretty costly. On the Vital, it's no charge. So some people are saying, you know what? Yes, the Vital plan might not have everything that I have on the Key or the Edge, but I can switch to that plan for next year and get no cost hearing aids. And then maybe next year I switch back. The other big one that's important to touch base on, and there's a question about this with medication changes. Typically what's been happening with the Key and the Edge is, as Kelly mentioned, medications go according to tier levels, and tiers 1 and 2, the generics, typically, if you did mail order, it didn't cost you anything. But if you were on a tier 3, certain medications like Mounjaro, Ozempic, possibly Eliquis, I don't recall what tier that was last year, but some of those medications, if it was a tier 3, you had a $42 copay, a very specific dollar amount. Now, next year on a tier 3, with all of those plans except for one, it's now a 25%. So if you're on Mounjaro, that's pretty expensive. You're going to pay 25%, not $42 anymore, except for on the Vital. So on the Vital, it is still a $42 copay. Now, the thing to remember is that a couple things have changed for next year as well in terms of things like the donut hole. Some of you may be familiar with that. If you're on very expensive medications, you may have gone into what's called the coverage gap or the donut hole. That's where, I won't get too deep in the weeds on it, but basically you might have been paying a certain dollar amount for your medications through the year, and then all of a sudden in August or September, your monthly cost goes way up and you wonder what happened. Well, you probably went into what's called the donut hole. Now, if that happened to you, you're probably familiar with the whole process. Next year, that donut hole goes away. There's no more. And what happens is the most that you could potentially spend in copays for your medications is going to be capped at $2,000. So you should not, That's the most. So if you're on some really expensive medications, even if you're paying 25%, if you hit $2,000, you're done for the year. The rest of your medication costs would be covered beyond that. I also want to mention, and that would include a lot of diabetic supplies. By the way, insulin, if you're on insulin, that's capped at $35 on all the plans. So that was the case this year, and it's the same next year. If you are a diabetic and you need supplies and you're having to pay for some of those, let us know. We have a company where we might be able to help you get some supplies at little or no cost. So we talked about things like the networks or the dental, vision, and hearing. With those, remember that you want to go to providers that are in the network. So with the dental, it's called Delta Dental. A lot of dentists are dropping out of that network, but a lot of them are still in. And so you're going to get your best rates, your best cost, co-pays, whatever it might be, if you go to a Delta provider. The vision is called EyeMed, EYEMED. So that's what, if you need to see an eye doctor, you might want to verify that they take EyeMed. And then the hearing, if you're going for a hearing aid test or hearing checkup, that's a network called True Hearing. That's all in the message or the information you're going to get from Priority Health. All right, so again, on the back of that agenda sheet that we sent to you were these different areas of what's important to you when you're looking for a plan. As I mentioned before we started this, most of you are going to end up staying on the Key and the Edge. Those have been the most popular plans for us and for most agents that I talk with or that we talk with. Those have been the most popular plans. And on Priority too, their Key was the highest selling plan last year of all the ones they had. It accounted for 50% of all their plans. I think most of you are going to stay there, but if you look at the back of that sheet, if something on there really grabs your attention, then we might want to look at something else, and we would invite you to contact us related to that. One last thing, a little sermon here that I need to give. Every year, this happens. You're going to get lots of information through the mail, TV ads, which can drive us nuts. It seems like every commercial. Now this year it's going to be fun between the politics and the Medicare commercials, but you're going to see those, and we're going to strongly urge you not to call that number on the TV. Don't answer the phone if you don't recognize who the caller is. Every year we have somebody that falls prey to that and ends up getting switched without even realizing it to another plan. Even you pick up the phone and you start talking, they record it, they switch things around so that you end up agreeing to something that is a new plan. So if you get a call and you answer it, you just need to be rude and hang up, because the longer you're on the phone, the more trouble you're going to get into. If you have questions, that's what we're here for. Okay, we're here to guide you through the process. So don't hesitate to reach out. I would say though that if you need to get a hold of us right now during this time of year, email's probably going to be the best option, and we will get back to you as soon as we can. But our today, again, my voicemail box gets filled up just like every day practically, and so it's a little hard to keep up on that. But emails, that helps us to keep a record going back and forth.
Hey, Bill, hi, Bill, can I say just a couple things? I have
Yes,
a couple, I noticed a couple questions on the panel there. Someone asked, and since I'll just say the enhanced dental vision premium for next year for 2025, the Key plan, it's $39 a month. And for the Edge plan, it's $49 a month. And if you have it now and you don't do anything, it will roll over to next year, just like with your plan, and you'll get billed for the new amount.
Perfect. Thank you.
Okay. Yeah, those were in the chat questions.
All right. Okay, so there's still a lot of information that came at you here. And it's funny because when we first started putting this together, we had a whole bunch of different plans that we wanted to go over to share with you. And then we looked at it and realized that's just too much. It's going to be sensory overload. It'll be too confusing. So we wanted to just kind of highlight, like Kelly did one with 0 premium, but it has a deductible, another one with a premium but no deductible, and then one without each. Here's the bottom line. We're going to take a lot of this information that we shared with you and distill it down into a summary that I think will help you kind of feel comfortable with either staying on your current plan or considering moving to another one. That'll come out in a week or so. We're still working on putting that together. But if all this information, you're still kind of feeling like, yeah, but I'm not really sure. Well, we're going to send that out, or certainly you can contact us and ask, but we're going to get you some more information that hopefully will summarize a lot of what we've talked about to kind of work through it. So anyway, I think, all right, I'm going to check see if there's any other questions.
Karen has if you're done, Karen has her hand raised, and if you want to come off of mute, Karen, and ask your question.
Let me unmute everybody.
Oh, okay.
I think
That
I
might
can
be
do that.
helpful.
Hold on, folks. And all right, Karen, go ahead. Karen, are you there?
I'm here. I did that in error. I'm so sorry. I don't have a question.
You were just giving us a high five?
That's it. Yep.
Well, good, Karen. Thank you for
Yep.
being here.
Absolutely.
All right.
Thank you, guys.
Sherry Norman. Hi, Sherry. Hold on. Got to unmute you. Sherry, can you unmute yourself? All right. Well,
Oh,
Sherry's trying. There, you there?
Am I there?
You're there.
Okay. All right. I'm sure I know the answer to this, but since the OTC is changing to links, I have that key plan. I'm assuming we'll get a new card. And is there an app that we can go to as well so you can check, your balance every month like we had on that OTC Anywhere?
I'm assuming we haven't seen the catalog yet, Sherry, and I'm guessing that will be the case. I can't give you a definitive answer, but new catalogs and new cards are going to come out with that new company and probably will come late December. Now, with that, and again, that's going to be separate from your Priority Health, your information for next year. That's a
Right.
different animal.
Right.
And also keep in mind that at this point, as we understand, you won't get a new card every quarter. You get one card, it just automatically
Right.
reloads every quarter. So
Right.
just like this year, that should be the same.
Okay. Okay.
But yes, I'm hoping, and I would have to believe that in today's world that there will be an app that you can use to to go through that. So
Okay.
thanks, Sherry.
Yep. You're welcome. Thank you.
And everybody that's on the call, go to Hog Wild when Sherry's working, 'cause she'll give you extra food for free, I think.
Yeah, right. Okay.
Also,
Other questions?
just
ahead.
I want to
Yep.
say this too, because only because we're getting right to 4 o'clock in case someone can't hang around. And you may, I don't think you said this yet, Bill, but if you have questions, send them in an email. I mean, I think you said that your voicemail gets pretty full, but email is the best way. So if you have a question you think of later, just send it to the Willing Group, and we'll make sure that we get your questions answered. It's
That can be
info@thewillinggroup.com.
or Kelly at thewillinggroup.com or
Or
Sarah at
Sarah.
thewillinggroup.com.
Or Bill
Bill
at
at the Willing.
thewillinggroup.com. Yeah.
There you go. Pretty easy.
Okay. Good.
I'm not seeing any more questions, but I do want to just say again how much we appreciate the opportunity to do this for you guys. You really bless us by entrusting us with this stuff. And I just want to say, we shared this at one of the workshops. We do some workshops throughout the year for people that are turning 65, not because we have to get the business, but because we're passionate about helping people understand this and think back to when you guys first got into Medicare. It's a pretty confusing world. So we love helping people figure it all out. But I want to say in terms of a business model, 100% of our business comes from referrals. So you guys and referring your friends and family and everything else, that's unheard of in this business. But you guys are just have really done an amazing job of referring people to us and continue to. And so if you do, I don't know if we even mentioned that, we will give you refer somebody to us, they make an appointment. You and that person will both receive a gift from us. But anyway, unless there's anything else, just want to say thank you, God bless, and stay well.